Okay, well, good morning, everyone. We're just going to give a few moments for people to join us as we are expecting quite a lot of participants. And then I will officially start the webinar once we reach about 300-400 people. Okay, we're at 423, so let's get going. Good day, everybody, and welcome to our webinar titling Tackling COVID-19's Hidden Crisis, Violence Against Children, organized by the End Violence Partnership and the Office of the UN Special Representative of the Secretary General on Violence Against Children. It's great to see so many of you joining us today from all corners of the world. We have over 132 countries represented in terms of registration. And it's great to see so many different types of organizations with a shared goal of ending all forms of violence against children. And thank you so much for your interest and in keeping children safe. My name is Trang Ho Morton, and normally I'm the Fund Portfolio Manager at End Violence, but today I have the privilege of being the Zoom Master. And to make the webinar as productive and efficient as possible, I would like to share with just a few housekeeping rules for all attendees. We have 90 minutes for the webinar, and we will do our best to be succinct and insightful. And if you haven't done so already in terms of the attendees, if you could rename yourselves so that we know the country where you are based and also the organization that you are working at. So for example, if I hover over my name, it will say rename, and I can put my name as Trang Ho Morton in parentheses, End Violence USA. Due to the high number of attendees that we have, we're now at 500 plus, we ask that you use the Q&A button on the bottom of the screen if you have a question or comment throughout. And please refrain from using the Q&A to say hello, as it makes it very difficult for the team to decipher if what is a question or comment. And when you type out your comment or question, if you haven't renamed yourself, it will be very helpful if you just specify in the box where you are working and to whom you would like to address the question, so that Howard, as the moderator, can call on the specific panelists to answer the question. And for those of you who registered before 11 yesterday, New York time, you should have received a news blast regarding social media and comms details. And so if you're posting on social media about the webinar discussions and findings, please use the hashtag #EndViolence. You can also tag the organizers' handles at SRSG VAC and at GP2EndViolence to follow them on the updates. You can also see these in the Q&A section. And the webinar is being recorded and will be shared from our social media accounts and website for those who are not able to join us today. We will also share the presentations and a short recap. I know we are expecting over 1,000 people, and I know many people will be joining in a little bit, so it's a really fantastic turnout for all of us. And thank you so much, and also thanks to those who are not present right now, but will be listening in later. And now I'd like to give the floor over to Dr. Howard Taylor. He's the Executive Director of End Violence. He will moderate the webinar and also introduce the speakers we have today. Thank you so much. Over to you, Howard.
Thanks so much, Trang, for that introduction and those very clear housekeeping arrangements. And I notice as people keep joining, we might need to repeat some of them a little later on if we go up significantly in numbers. And a hugely warm welcome to everyone joining from all over the world. As we heard from Trang, we have participants registered to join, I think, from 132 countries. And that, I think, is indicative of the common purpose that we all share about how best can we keep children safe during COVID-19 and beyond. And the number of participants on today's webinar, I think, is also itself an indication of the power of partnership and collaboration, which are two of the key ingredients which we all know we need to protect children in their new realities of COVID-19. So it's my great privilege today as Executive Director of the End Violence Partnership and Fund to introduce our speakers. All of them are leaders who will share their national, their regional and global perspectives on how governments, UN agencies, civil society organizations, faith groups, children themselves and others are responding and can respond to keep children safe during 2019. And we'll hear about what the needs are, the challenges, and even some of the emerging opportunities. Among the speakers today, we'll hear from the Special Representative of the Secretary General for Violence Against Children. We'll hear from UNICEF's Child Protection Chief, We'll hear from the Executive Director of the African Policy Forum, from the Swedish government and the Swedish National Centre for Violence Against Children, and from World Vision's Global Sector Lead on Child Protection. And yes, they all have names as well as titles. So let's move straight into that. Our first speaker, who probably needs no introduction to anyone on this webinar, is Dr. Najat Mala Majid. Najat has been since last July the Special Representative to the United Nations Secretary General on Violence Against Children, a role which she has embraced with new energy and rigor and vigor. And we look forward to hearing from Najat, who is going to open by framing our conversation today. Najat, the floor is yours.
Thank you, Howard. I will try to make it shorter and straight to the point because many things are already very well known by our audience. I just want to remind that this pandemic is first not only a global health crisis. As you know, this pandemic is a humanitarian, socio-economic crisis that will exacerbate inequalities, discrimination, social disparities, and children vulnerability. In the words of the UN Secretary General, what began as a health crisis risks evolving into a broader child rights crisis. As we know, all of us, that COVID-19 has direct and indirect effects on children, not only in short term, but also on mid and long term. The COVID pandemic has increased the vulnerability of children due to movement restriction, confinement, and disrupting provision of already limited child protection services and safeguarding measures, as well as loss of income, isolation, high levels of stress and anxiety. We know that 60% of all children are now living in countries where a full or partial lockdown is in place. We know also that 1.5 billion children and young people are affected by school closures. We know also that growing economic vulnerability for children experiencing extreme poverty will increase the threat of child labor, child marriage, and child trafficking, sexual exploitation, and recruitment into criminal groups and armed groups and forces. And we know also that an estimated 42 to 66 million children could fall into extreme poverty as a result of the crisis this year, adding to the 386 million children already in extreme poverty in 2019. We know also that COVID-19 pandemic is causing increase on violence against children. Children's risk of experiencing and being exposed to witness violence, such as violence and abuse in the home, as well as different forms of violence from outsiders, including the online settings, are increasing exponentially. Since the beginning of the pandemic, credible news sources in many countries around the world are reporting a huge rise in the number of domestic violence reported. To supplement children's learning during the pandemic, about 2/3 of the countries introduced online learning platforms. Children's reliance on online platforms for distance learning has also increased the risk of exposure to inappropriate content and online predators due to increasing opportunities for offenders to engage with children whom they expect to be more vulnerable due to isolation, less supervision, and greater online exposure. And we have more data regarding this issue, and also the recent report launched by Europol on March 2020 that indicates an increased online activities by those seeking child abuse material. Children are also facing in some countries arrests and excessive use of force by law enforcement while enforcing lockdown decisions against children on street. Racism and xenophobia are rising against certain groups who are perceived to be linked to the coronavirus. And we know also that there is an increasing vulnerability of children who are already vulnerable, including refugees, migrants, children living on streets, internally displaced children, children deprived of family care, children deprived of liberty, children living in conflict-affected areas. These children are especially vulnerable to violence, exploitation, social exclusion, discrimination, as well as to development and mental health issues. And we know also that many child protection services are disrupted. Child Helpline International is reporting that many member organizations are struggling to keep up with the increased demand while observing social distancing and other measures to keep the workers and volunteers safe. Civil society organizations are reporting that they have had to suspend their psychosocial and other services provided to vulnerable children, including those who live in refugee and internally displaced people's camps, children living in the street, etc. We know also that COVID harms children's mental health. Toxic stress and anxiety have negative effects on the mental well-being of children themselves. Due to the disruption of safety nets, children feel unsafe, insecure, scared, lonely, isolated. We know also that children are invisible and not seen as part of solution. Children are not duly informed in a child-friendly manner and with age-appropriate language on the effects and responses to COVID-19. Children are not duly listened about their experience of the current response to COVID. Their initiatives are not duly amplified. We still need to provide opportunities for children's view to be heard and taken into account in decision-making process on the pandemic through consultation dialogue. But I want to focus more on one main point for me, that we need for all of us, to prepare for the immediate post-crisis phase of the COVID-19. It's really time. Until a vaccine or a cure becomes widely available between 12 and 18 months, there are likely to be several secondary waves of infection across the world that may require forms of lockdown to be reintroduced. We need to ensure that the lessons learned on VAC-related aspects of the first lockdown are integrated into emergency preparedness now, including the development of protocols for service delivery and the protection of children's rights. This financial crisis will have implications on all layers of the protective environment around children, and this will undermine the progress of SDG 16 as well as other related SDGs. The global economic crisis caused by COVID is likely to severely reduce the fiscal space of government, reduce tax receipts, limits on debt financing and borrowing, and for low income and middle income, the reduction in donors' assistance. Government will likely respond with austerity measures and may cut services for children. The key point is that the COVID-19 crisis is time limited, whereas the negative impact on the health, development, and protection of the generation of children living through it will be permanent. This must be avoided at all costs. The VAC community needs to consolidate evidence of when governments threaten child protection and other related services, and for advocacy against turning a short-term crisis into a long-term reduction in children's human development potential. The VAC community must emphasize that EVAC, ending violence against children, requires an intersectoral and child rights response, preserving health, education, and child protection services, all of which must be built on the foundation of permanent social protection systems, including universal, non-conditional child grants allowance that will protect children and their caregivers from economic risk. The VAC community must emphasize that solidarity, multi-stakeholder cooperation, and multilateralism are needed now more than ever. The VAC community needs to involve more and more and mobilize more and more governments, bilateral and multilateral donors, civil society, faith-based organizations, private sector human rights and human rights institutions, workers' organizations, and leaders in every sector to ensure a unified child rights and multi-sectoral response at global, regional, and national level. To this end, I think we have some challenges to face. First, for me, the VAC community needs to switch from separate and sometimes competitive message and action to adopting a unified and common message and agenda for action. And I want to remind you that one agenda for action document was done through a consultative interagency process and that was built on the SG policy brief and the leader statement and contain many action-oriented that could be used. And to conclude, what I want to tell is to ensure children are included and part in all COVID response and recovery decision, ensuring no child is left behind. As VAC community, we need to speak with one voice. We need to reach more and more policy makers and influencers in a coordinated and complementary manner. We need to involve and amplify voices of children worldwide. We need to provide more and more action-oriented and context-specific solutions. We need to support a strong social mobilization and to switch from top to down, from country level to global level. Many thanks for your attention.
Thanks so much, Najat. That was a fantastic opening. I think you've really called out the increased risks that children face now. I particularly like what you said about making sure that we learn as we go from this first phase of COVID-19, because there will be future waves and maybe openings and lockdowns, and we need to really make sure we're learning as we go. And that critical messages you finished with there about a unified agenda, unified advocacy, and of course, including children, making sure they're not invisible, but also making sure their voices are heard and they are an active part of the solutions. Thank you so much for that opening. Before I bring in our next speaker, I just want to acknowledge questions that are being asked in the Q&A. The chat box is disabled for this webinar because of the large number of people. So do please ask your questions in the Q&A, and we will be moderating, and I'll pass those on to the speakers as we go. So just before I hand to our next speaker, also to say that we will, after this webinar, circulate a brief summary of the headline points made by the speakers. I appreciate that for many of you, we know we have people from over 130 countries, but English is not your first language, and we will be preparing a brief note so you can catch up with some of the details that might get missed as some of us speak at speed because there's a lot to cover. So our next speaker is Cornelius Williams. Cornelius is the Associate Director and the Global Chief of Child Protection in UNICEF. And Cornelius is going to follow up Najat's opening framing remarks to get a global perspective and a sense of what UNICEF is seeing and doing and how it's responding, and also picking up on the recent leaders' statement and how that might be used as an advocacy tool for us all. Cornelius.
Thank you, Howard, and thank you, Najat, for that good introduction. So, can we move to the fourth slide? Right. As Najat has mentioned, actually, this pandemic actually has swept the globe into uncharted territory, with over 4 million cases and close to 3 million deaths. That's what we know at this point. The scale and scope are mind-boggling. In UNICEF, we haven't seen such a pandemic, and we have mobilized our capacity as UNICEF throughout the 190 countries where we have a presence, and we're working with both humanitarian and development actors. This is an emergency. While children seem to be less vulnerable to the virus itself, the collateral impact on children is devastating. As Najat has said, the SRSG VAC, we may be facing the greatest child rights crisis of our generation. When we look at the numbers that we in UNICEF have analyzed and put together, it's estimated that over 117 million children may be missing out on receiving life-saving vaccination, medical and nutrition services due to the disruption. We have over 1.3 billion children in 186 countries. That is 74% of all enrolled learners who are directly affected by the national school closure. And one of the things we fear is that the vulnerable and hard to reach children are in danger of dropping out altogether and not coming back to school. Now, the public health measures can also highlight the vulnerability of these at-risk children, some of which, again, the SRSG VAC has pointed out. And we're thinking of children in residential care, refugee and migrant children, children who are incarcerated or in street situation. Despite all these acute risks that we can see, the public health response to COVID-19 has been largely blind to the child rights and protection concerns that we see. Now, As has been said before by Najat, actually, there are new stressors that are arising from the school closure, disruption of livelihood, home confinement, isolation. We know that actually prior to the pandemic, there were 3 out of 4 young children who were regularly subjected to violent discipline. We know that 1 in 4 were living with a mother who was physically abused by her partner. And we are aware, as it has been said, the frequency and intensity of such abuse can only increase in the context of these new stresses, which we are now all talking about. Unfortunately, these stresses come at a time when children are cut off from their social support in their extended family, in the school, in the communities, right? And then they rely on when in distress, at a time when children are less visible to the range of professionals who normally engage with them, like teachers who would detect that a child has been abused, or community leader, or community member, or religious leader. As Najat mentioned, we've seen from Child Helpline the skyrocketing calls, and we have an example from Childline India, where they received 92,000 SOS calls asking for protection from abuse and violence in the first 11 days of the lockdown. This is a 50% increase in their calls. At the same time, actually, it's ironic, we have seen the report of child abuse and neglect made to child protection authorities drop because the child protection authorities do not have access to these children, or the supporting adults do not have access. Again, as it has been mentioned, children have been, with the school closure, children have been moved from the physical to the virtual space, right? And they're spending a lot of time learning, playing, and socializing online, which is also, as it has been said, exposing them. There are figures actually that we have, like from the National Center for Missing and Exploited Children, that shows a 160% increase in report of suspected child sexual exploitation when compared to March last year. So this is a worrying situation. And we believe actually that these children need help, but the structures and services that are provided to help them cannot help them at this period because they are isolated, they are closed off during this containment period. In this context, I'll turn to the leader's statement. Our executive director was excited to endorse the leader's statement. I've never seen her so excited about her statement. In our view, the value of the letter lies in 3 key areas. First, it established a united front in a community for the protection of children. It is remarkable that the statement was signed by the leaders of 22 of the most consequential organizations engaged in combating violence against children. This letter has set the framework for some of the strongest interagency collaboration I've seen. Second, it sustained a high level of national commitments to end violence against children. Can you change the slide, please? It's a commitment that must not be suspended at the time of COVID-19. I am thinking of the 29 countries that have joined the End Violence Partnership as Pathfinder countries, as well as a community of donors and international financial organizations. Ending violence against children needs to be a priority in the COVID-19 response, both in the containment and in the post-containment phases. Third, the letter sets out an agenda for action to protect children during this pandemic. It is relevant, and identify key elements of our collective response. And that collective response, we in UNICEF have prioritized 4 of the key interventions under the agenda for action. And we're building on the lessons that we've learned from Ebola and other public health responses. First, in order to address the stresses that have been heightened in the home and environment, UNICEF is helping to ensure that positive parenting resources are available to all parents in collaboration with other partners. In Jamaica, for example, UNICEF is adopting a national mentorship program to meet the needs of parents grappling with the implication of the COVID-19 crisis. In Jordan, UNICEF has established a community-based WhatsApp group for parents of children under the age of 6. So where there is internet, we're going digital. Secondly, to ensure that children have a place to reach out to help when in distress, UNICEF is strengthening and adapting the National Child Helpline. You would see that actually in Najat, the SRSG for Violence Against Children mentioned that. In Bangladesh, we supported the toll-free child helpline 1098 to enable them to take an increased number of calls and strengthen the referral. In Georgia, we support the launch of a new toll-free child hotline, and it aims to provide immediate need to respond to the immediate needs of children during the pandemic, including referral. Third, to ensure that essential child protection case management service continue in the context of the lockdown and social distancing, UNICEF is supporting Department of Social Welfare and social service workers to adopt service delivery. In Indonesia and Malaysia, UNICEF has adopted guidance for social workers that is disseminated to the National Professional Association. In Afghanistan, UNICEF accelerated the validation of the National Case Management Standard Operating Procedure with physical distancing and remote participation measures in place for participants. Finally, we must remain vigilant to offenders using the pandemic as an opportunity for their online sexual exploitation of children. In the Philippines, UNICEF is working with partners to reframe online safety measures to include COVID-19 specific issues related to mental health, parenting, and reporting abuse. In Dominican Republic, UNICEF supports the National Authority for continuity of their standard operating procedure on online sexual exploitation in the face of increased local production of sexual abuse material. Now, while the pandemic has forced interruptions in many aspects of our work, we must remain steadfast in our responsibility to protect children from all forms of violence. And we will prioritize these 4 key interventions in our countries, and we will be prepared actually on the post-containment phase to support countries in building back better their social services and the prevention services. Thank you, Howard.
Thanks so much, Cornelius. I'm going to come back to Najat now, if I may. We're having a lot of questions in the Q&A, and we'll try and do our best to answer as many or the themes emerging as we can. And Najat, there's been a couple of questions. One is around how can we make children visible in the current situation, and including in reporting, and how can we increase awareness, be ready for the post-crisis phase? That was from Gillian Van Ternut. And a question from Jayatri in India, which is how can we make sure the global response is properly based on country needs and specific contexts in countries? So I don't know, Jat, if you want to respond to either or both of those now, and then we'll come to our next speaker in a moment.
Just, I have the question regarding visibility of children, and the global situation, and what other? I forget.
The one was about country context. How can we make sure that what's happening at the global level is informed by country context?
I think what is important first to make children more visible, and when you are seeing all the statements and all what is going on, even within the policymaker at high level, we are speaking more and more about vulnerable youth, women. I am not against, it's important, but we need to make sure that they are visible. How we can make them visible as VAC community, I think it's important in all our action, in all our advocacy, to make sure that children are part of all these policymaker statements. But not only, I think what it's important is to see them as really actors and part of solution. And I know that many things are going on, done by many civil society organizations, really to make sure that the voices, their experiences, their peer-to-peer initiative are taken into account. And it's our role. This is very important regarding advocacy, but regarding also all the, to involve them and to amplify and to highlight what they are doing. Regarding, the fact that we need to make sure that country level, and it is why I am insisting on the fact that we are a big network. We are here at global level in New York, but what is important is how we can mobilize through all the implementing agency, all the UN implementing agencies, civil society organization, faith-based organization, network of children themselves, how we can really make sure that we have this information at country level and we mobilize, and what all these statements that we are doing, all this agenda for action that we are establishing in a collegial manner are really relayed and transmitted to the local level and national level. This is very important because, and I think also what is important, what we saw that some countries are really doing many good things, considering all child protection services as life-saving services and really be part really in the COVID response. And I think it's important also by showing that it's possible, and we have already many examples. I think it's really important. And regarding, you know, the point about, you know, the global level, and I saw some question regarding what we can do. I think currently what is going on, and it's the first time that all of us are really affected by this COVID. And I think what is important currently is, yes, we made statements, we made call for action, but we need to make sure that all what we are doing and calling for is implemented. And we need also to have an advocacy, context-specific advocacy, taking into account each country and each specificity. And it is why I'm telling we need to review and to have a kind of self-criticism and to go more ahead to see how we can make sure that these are going to be translated in concrete action. This is really very, very important to build this network and to really, if all these NGOs can bring all this information, because here we can really give more visibility on this issue. And I think this is very important currently for me, is to make sure that we are action-oriented, we are not reactive, and we need to be more proactive regarding, you know, the post-COVID, because the risk of decreasing of budget, it's important. And also regarding all the donors and the international community, I am sure that the budget of donation, of partnering will decrease. And we saw already some NGOs who are facing really the decrease of this support. And I think we need also to tackle also the international communities and bilateral, multilateral, not only at global level, but also at country level.
Thanks so much, Najat. I'm going to move to our next speaker now, Dr. Joan Nanyuki, who is the Executive Director of the Africa Child Policy Forum. She's going to bring an African perspective and talk specifically about some of what she's seeing and observing and these challenges in Africa. And Joan, as you come on, we also have a question from Evariste in Rwanda, which is specifically around how best can we advocate to the government to pay more attention, and particularly with regards to budgeting for ending violence and child protection. She also had a subsidiary question about street children in particular, looking after them, which Najat mentioned in her opening remarks, some of the more vulnerable children, and Cornelius also picked up on. But Joan, if you want to, when you speak, also maybe pick up on Evariste's question about advocating to government. How do we make the case in the current situation and beyond for governments to not just pay attention, but to actually put resources behind child protection and ending violence? Joan.
So thank you, Howard. Thank you very much. And thank you for the good introduction. So as you have said, I will be sharing my perspective as a Pan-African organization. And what I will do is first share with you our learnings over the last 3 months, based on what we have seen, what our partners have shared with us. And then I will go into the opportunities, but also a little bit about the challenges that we have faced. But before I go too far, I want to start really by acknowledging the solidarity and the efforts that we've seen of African governments across the continent in responding to the pandemic. In particular, the responses, the speed of the response, and also taking into consideration learnings from countries that had been hit earlier and applying these lessons into the African response. That, however, I will come and mention as a challenge at some stage. But to share with you the learnings, we are seeing this is really one place where it has given us clear indication that all policies must be human rights centered and must be child rights friendly. And this is the need to really consider the best interest of the child, to be inclusive of all those children, particularly those at greatest risk of violence. And we know these children, they are those millions living in extreme poverty, others caught up in situations of armed conflict, others with no parental care. There are the refugee children that have already been referred to, and some on the African continent who are even stateless. And of course, we have the millions of children who are out of school and therefore have no access to learning, to the school feeding programs, and to the safety environment that is normally offered by schools. So we are learning, how do we really prepare and support governments to implement child-centered policies? Second, we are also learning that and being reminded something that we already know on the need of programs to be contextualized and to be needs responsive. And that is actually linking to one of the questions that was already answered by Dr. Najat on the need to adapt policies to the lived reality for African children, while at the same time adhering to the guidelines issued by WHO and CDC at this time. It calls for a lot of creativity and innovation on our part as Africans. For instance, to really appreciate what does social distancing mean for children who live in overcrowded settings, families which share one single room for a family of 5 or 6. What does also frequent hand washing mean for girl children who have to walk long distances to fetch water because they do not have running water in their homes? And what this has really taught us is there is no blanket solution. Countries must be able to adapt quickly, and come up with mitigation policies that factor the pre-existing situation of children, vulnerabilities of children to violence, and then the additional layer that has been induced by the pandemic. And again, these policies must not only be contextualized and adapted at national level, but this must go further down to adapt to different regions and even different parts of regions and districts within the same country. And so we are seeing that an integrated multi-sectoral approach really to addressing child protection and prevention of violence against children and the most vulnerable is now more important than any other time. I want to come now to the opportunities that we are seeing. And for us on the African continent, there's the value of community partnership. And I'm sure this applies across the globe. But this is really a time when we can work more closely with communities to help in protecting children, to help in minimizing the vulnerabilities, especially of children who are out of school, children whose family members and parents have lost employment, have no access to means of livelihood. Communities are critical partners, especially in policy implementation, and particularly in our setting right now, where many children will not be able to access government institutions and structures, and are again removed from the safe learning environments. It is important for the response programs that are building onto community existing structures and mobilization elements for them to be able to have a bottom-up approach, which is likely to have a more sustained result and be more sustainable in the sense that the COVID response is not going to be 3 months response. We don't know if it's going to be 6 months or 1 year. So the element of sustainability when we work through communities. The last opportunity we have really is to strengthen the social economic safety nets, which are crucial elements when it comes to protecting children and vulnerable households, and especially in meeting the needs of the most vulnerable children and thus protecting them from violence. Rapidly introducing or scaling up economic safety net programs such as cash transfers, food assistance, access to free or subsidized healthcare will go a long way in helping families and vulnerable children to cope, and therefore not to resort to forms of child labor, sexual exploitation, child marriages, or other forms of violence that we are seeing likely to increase during this time. In addition, there has to be alternative means of providing the missed school feeding programs. And it is really an opportunity for us to explore how we can work more closely as civil society with communities, with faith-based organizations on the ground, with NGOs to find alternative ways of children accessing the feeding programs. And in the same way we are working towards finding ways for children to access learning during this time. Throughout all this, we have also an opportunity to bring to the middle the children who are always at the peripheries. And I want to speak to two particular groups who have emerged in our work and in our interaction with our partners. And those are children in conflict with the law, but looking at these children as children who are seen as juvenile offenders and who are now caught up within the criminal justice system, but are likely to go through processes of early release and possible reintegration. How do we ensure that the release and reintegration does not leave them exposed to violence, that the stigma associated with having been a child offender or suspected child offender, that stigma does not cause them to go into cycles of violence that will lead them to future offending. And the other category of children that we have come across is returnee children who are coming back to their home countries from neighboring countries where they had gone for different purposes, either work or migrated for different reasons. But these children returning to their countries of origin in states of poverty and sometimes unaccompanied and having no parental care and being therefore at increased risk of violence. There is really an opportunity for us to step in and ensure that we can bring these children to be able to access the mainstream responses that are normally factored in for most of the other children. But more broadly at a continental level, I want to share about really an opportunity that we have that at the African Union level has really been seized well. And we have seen the African Union has mobilized resources to the extent of even constituting a special committee on COVID-19. But for us as actors on prevention of violence against children, it is an opportunity for us to ensure that we can advocate so that protection of children from VAC becomes an agenda on this committee and therefore becomes an agenda at the African level. And then moving forward, see how we can sustain that agenda in the long term. It's also an opportunity for us to see how into these African Union mechanisms, including the African Committee on the Rights and Welfare of the Child, how do we bring in the local voices based on what we're hearing from our partners on the ground, but also reflect the global voices and calls at the African level. The other opportunity that we have, and we are also seizing, is collaborating and working more closely with the regional economic communities, which are really quite a force on the African continent. And we have already seen excellent examples of coordination of efforts and collaboration in the Southern Africa Development Community, and even just yesterday on the East African Community where the heads of state met. And while these are very good examples of collaboration and coordination, how do we ensure that it is not a one-off, but becomes something that is consistent and therefore can be applied in protecting children from violence during this time, but on a more sustained basis? And how at the same time do we bring the children at the periphery to the center of this coordination of responses, particularly those who live on the border communities and children coming from countries which are either in conflict or post-conflict. I also want to share with you, before I conclude, some of the immediate challenges that we have faced and some of our partners have shared with us. And I will put these as three. One is that the demand is way bigger than we can respond. And this is why one of the things that is really critical is us coming together as this coalition, as this partnership, to really bring our efforts to consolidate them and to really have solidarity in our advocacy, but also in providing technical support to governments. The second element is the difficulty in accessing the children who previously we could have accessed, and even in accessing, therefore, the primary data that is critical in us as civil society providing to government to enable them to develop policies that are evidence-based and therefore very sound. We are working around that. It just means that work is more difficult, it takes much longer, we cannot reach as many as we would want, but that really is something that is quite a challenge for many organizations, including ourselves at African Child Policy Forum. And the last challenge really is the reality that the ground is shifting faster than we can implement the policies. So how do we develop policies that do not lag behind the reality of today? Because what worked yesterday no longer works today or tomorrow. So how do we keep our policies current, identify problems quickly, make decisions in a timely way, even with limited information, but still design interventions that will work in protecting children and in really mitigating the increased vulnerabilities to violence. Thank you very much. Thank you very much for your attention. Over to you, Howard.
Thanks very much, Joan. It's great to hear you, and it's great to get that perspective from Africa around the challenges and the opportunities. Thank you so much. I just want to call out that in the Q&A box, a couple of things are happening. One is that the panelists are responding to some of the questions you're asking in real time in the Q&A box. Thank you to the panelists for doing that. Secondly, there seems to be a theme running that people want more information, more detail. What are the specific tools? What are the specific policy guidance or interventions and evidence-based ways of working that we can make work? So we will make sure that after this webinar, that we undertake with our partners, the panelists and others, to make sure that we get that evidence, we get that guidance, we collate that information, those interventions, and make sure that everyone who wants that has access to that through the various platforms which we have between us, including the knowledge platform of the End Violence Partnership. I just wanted to mention a few of the things that are being raised, some of the issues that are coming up. There's a specific one from Radosh at the World Organization Against Torture around advocating for the pardon and release of children from detention, where they are particularly vulnerable, even more so right now. There's a theme around gender responsiveness. What are the gender responsive approaches, particularly to help girls? That's from Gisela from Plan International. A question about how do we get money to the grassroots organizations? We had the earlier question about money to governments. A question about how can we get money to grassroots organizations? That's from Nia Vera in Mozambique. A question about children online. We know that so many more children are online right now, as are the people who wish to harm them. Questions about child helplines, which I'll come back to Cornelius, to you later, about that was specifically to you, about how we can make child helplines sustain and make sure that they're owned by governments in every regard. That's from Francois. A question from Carol in Costa Rica, acknowledging that children's regular medical needs, not those that are COVID-19, directly COVID-19, but regular medical needs are not being met because of the inability to get to hospitals and clinics, as well as some negligence sometimes by their parents and caregivers. And how do we deal with that? And a point from Kim at the Child Resiliency Program within the Partnership Alliance, the Violence Prevention Alliance, sorry, about how do we get the honest voices of children to feed into solutions, because it's difficult to get children to be able to speak freely in front of their parents and caregivers. We'll come back to some of those later, but if the panelists coming up choose to address any of those as you go, that would be great. Our next speakers are both from Sweden. We have Anna Nordlander and Maria Scalacci, respectively from the Swedish Ministry of Employment and from the Swedish National Centre for Violence Against Children. They're going to talk a little bit about the Swedish response, with a particular angle, I think, around a focus on schools and about the collaboration they've had across their governments and CSOs. And before I hand to you, Anna, just to say there's a question from Riza Garcia, which was around what are specific tools which might be available to help educators? What are the examples of those tools which can get into the hands of educators to make children safe in school? If you want to take that as you go, you're very welcome. So Anna and Maria from Sweden.
Okay, thank you. And I will go first. Dear Special Representative, Secretary General, Excellencies, ladies and gentlemen, and colleagues, and I work at the Ministry of Employment in Sweden, and I'm the Swedish focal point for the Global Partnership to End Violence Against Children. I'm honored to be participating in this panel, and I'm also here with colleagues, as you've heard, Maria Scalacci and Laura Coronan from Barnafrid at the University of Linköping, as well as my colleague Jessica Gossi, who works with child rights policy issues. And as all countries, Sweden is also very concerned regarding the primary and secondary effects that the COVID-19 pandemic will have on the well-being of the global child population. We are worrying about instant access and the right to education, food, safety, and health. In particular, we worry about those in the most marginalized and vulnerable situations. We know that crisis and disaster shows without any doubt that it will affect the population very unequally. Those with the least resources and in the most disadvantaged circumstances are generally those who suffer the greatest strain. The coronavirus threatens to worsen the vulnerability of children and young people at risk in their home environment. In the light of the consequences of the COVID-19 virus and its impact on already vulnerable groups, the Swedish government has decided to allocate 100 million Swedish crowns in 2020, and this is going directly to non-profit organization with to address the increased vulnerability that is resulting from the outbreak of COVID-19. And also it will work with women, children, and LGBTI people who are victims of violence. So that may answer one of the questions perhaps. Sweden is also supporting WHO with extra funding to the contingency fund for emergency, the COVID-19 fund, as well as supporting other UN institutions. We also aim to strengthen communication on a base level, which is why our Minister for Children's Rights, Åsa Lindhagen, has been having special press conferences for children. And at these meetings, the children have met with the minister and other experts, and they are able to ask questions directly to the minister. And we have found that the children do have a lot of questions. They wonder, what do the minister do to prevent children from getting infected? When can I meet my grandfather again? And can we actually go to the beach this summer and swim? Authorities, ministries, municipalities, and cities and global and civil society organizations in Sweden are working together to try to meet the need for accurate and updated information on children and COVID-19. Our Ombudsman for Children in Sweden is working together with the Public Health Agency. They develop and promote child-friendly information, and they try to aim this at different age groups and also to children with special needs. So these were a few words on an overall perspective from Sweden. And now I would like to pass on the word to Maria Schilacci at Barnafrid, who will present a perspective from a more research point of view. Thank you. Maria.
Thank you, Anna, and thank you to the SRSG and Violence for inviting us all to this very important and timely webinar. My name is Maria Schilacci, and I'm a child psychologist and the program director of Barnafrid, the National Center on Violence Against Children in Sweden. And for the Q&A and the final remarks, our director, Laura Korhonen, will also join us. Sweden's National Center on Violence Against Children was initiated by the Swedish government in 2015. And the objective is to do research, to develop effective evidence-based programs, and to be a competent center for all actors working with violence against children. We work both nationally and internationally and collaborate with governments, authorities, academic institutions, and civil society. We have a special focus of directed towards the professionals working directly with children who are victims of violence. We have national networks such as the National Barnahus Network that are doing a very important job. In the ongoing COVID-19 pandemic, we see a need for an assessment from a child's perspective with an emphasis on children's situation and special vulnerability. Crisis and distress are known risk factors for children's health and well-being, including violence. And in the current situation, actually, all children should be considered a risk group. Why? Because the already known groups of vulnerable children need attention, but the vulnerability can be bigger even in other, currently unidentified groups of children. As you may know, Sweden as a country has chosen a different path during COVID-19. The preschools and schools up to 16 have never been closed. We are socially distancing, but we have never been in lockdown. So the question that we at Barnafrid are asking right now are, has the pattern of violence against children changed in Sweden during the COVID-19 pandemic? What impact has the Swedish path on tackling COVID-19 on violence against children? And can we draw any conclusions already now? The discussions here in Sweden has mainly been about the risk of increased vulnerability when people are forced to live in isolation due to the pandemic. Partly that the situation of already vulnerable children can get even worse, but also the danger of increased online sexual abuse due to children spending more time on social platforms. But are there any valid statistics on how things are going so far? The information right now is based in Sweden on an increased number of calls early during the pandemic to all our important helplines and chats directed to children, but no exact figures or comparison over time have been published. The social services, the child and adolescent psychiatry, the pediatric medicine have not indicated an increased influx of patients. Statistics on reported crimes in April show no indication of increased violence against children. So in regard to this, do we have a problem? Yes, we actually do, and that is the lack of up-to-date and valid statistics that makes it difficult to say whether or not violence against children has generally increased during the COVID-19 pandemic in Sweden. As it is now, we are grappling with the matter. The decisions that must be made then are to a large extent based on an assumed risk and data from other countries, which may have chosen alternative ways to handle the COVID-19 pandemic compared to Sweden. In the future, it will be an important and necessary task to study how children's vulnerability and the problem of violence differ between the different countries with alternative solutions. But already in Sweden, an assessment is needed right now for an understanding of how the system works as a whole. To do this, reliable numbers and indicator data are necessary. As a precautionary measure, we therefore propose that helplines and chats report their statistic. This should be an important early indicator of the need for support and shifts in the same. That national and international key players come together and jointly define what kind of statistics on violence against children should be followed up. And that this data is analyzed with expert support, taking into account known risk factors for violence. We do not have the whole picture clear about violence against children in Sweden during COVID-19. There is a risk that the system does not reach those who need help. But at the same time, one might ask, what would be the explanation if violence has not increased? Sweden as a society has been working long-term on child protection issues since the beginning of the 20th century. There are reasons to assume that we have succeeding in building a system that can stand up well during the crisis. But the system's resilience can never be taken as given. On the contrary, the prevailing situation requires that data is followed up and analyzed constantly in a logical and a scientific way. This is not least for the upcoming work on maintaining and strengthening protective societal structures, with also reforming them appropriately and with a wise allocation of resources. If Sweden succeeds in paring the supposed increase of violence against children, this is a proof of concept that proactive preventive measures during the crisis will pay off. In the future, it'll be interesting to see whether the decision to keep preschools and schools open may have been a decisive measure for child protection during COVID-19. The issue of violence against children is important to society and should be constantly reviewed and high on the agenda. And in order to meet future challenges and reach goal 16.2 on the Agenda 2030, reliable and knowledge-based data must be the golden standard for all pathfinding countries to address the safety and well-being of our children. Our children that in the ongoing crisis have shown wise behavior and incredible ability to adapt, for which we all can be very proud. So if not now, then when? Global cooperation and coordination is needed now to prevent this health crisis from also becoming a child rights crisis. Let the Convention of the Rights of the Child lead us through this. And lastly, we welcome the joint global leadership of the SRSG and End Violence on this important subject, and we look forward to continuing contributing with our knowledge programs and network on this. Thank you.
Thanks so much, Anna and Maria. It's great to hear both from a government perspective, and Anna, there's some of the examples you gave that Sweden is doing, which may be unusual and proactive, such as the minister having press conferences with children to hear from them directly and let them directly inform, give them that voice into government policy. And Maria, your summary of the research and the academic side of it and where the gaps are and what you're doing, thank you for that. I think these are all important parts, and that goes back to an earlier point about we must learn as we go in real time and make sure that we have that rigor, that we're tracking progress. We're tracking what works, what doesn't, and there's a feedback loop from that learning into the action, into the advocacy. So thank you for those perspectives. I'm going to come back to Cornelius from UNICEF now. Cornelius, I have three issues for you to address, if you can, briefly, please. Questions one from Michael, which was earlier on in the conversation, which is, what can child protection specialists specifically do? How can they take action? How can they help? One from Francois about child helplines nationally. How can we make sure they're supported and they're nationally led, government owned, and the role they have to play? And then one from Raki about trafficked children and their access to health services beyond child lines, etc. What else could and should we be doing to make sure that trafficked children are being reached? And then Cornelius, when you've responded, I will come to our last speaker, and then we'll have some further questions and conversation after that. Cornelius.
Thank you, Howard. And you had raised the issue before of the child helpline and how can it be owned? So let me start from that point, actually. And there are models where the government is supporting child helpline, where, for example, in Kenya, the government is it's jointly owned and supported. So there are several countries where government do a contribution to the helpline, and the helpline is then linked to the statutory service or the child protection authorities who would respond to, and then when these children are referred. That is the most sustainable, making the child helpline part of the national child protection response in that country, and then being budgeted for by the government and being supported by the government. In terms of child protection specialists and what they can do, definitely the child protection specialists, they are still frontline workers, the child protection specialists. And what we have seen is that they're working on case management and trying to get the case management to become remote. That is, advocating with government so that they recognize that child protection workers and the social workers are essential services. We saw the response in China, and we've seen the response in a couple of countries, also Kenya, where the social worker and the child protection workers were made essential workers and were provided with protection and were provided with authority to move around during the lockdown. In terms of trafficking, it's the usual challenges we have with this usual invisible population. And usually, actually, most of them, wherever they are now, would be cut off, actually, from their source. We did, there was a story of a boy who was cut off from the community worker who was helping them. Now, there are ways, actually, if they come out for services, we should create awareness among service providers, those who are providing food, those who are providing shelter, to the usual we would have done with immigration or border patrols, to look at signs that we now know of people who are trafficked and how to respond to those, and to have referral networks ready for those who come forward when we identify them. But we should be careful not to identify them and not provide them with the services. Over to you, Howard.
Thank you so much, Cornelius, for those responses, and more to come after we hear from our last speaker, and by no means least, it's Bill Forbes, who is World Vision's global lead on child protection. And Bill is going to speak to World Vision's response, but also bring in some country-specific examples. And Bill, as I said earlier, if any of the issues that you've seen in the Q&A I have raised, if you choose to touch on some of those as you go, that would be great. Over to you, Bill.
Great, thank you. And I'll just check, can you see my screen?
Yes, we can.
Fantastic. Okay, thank you very much to the Global Partnership and to the Special Representative for the chance to speak today and share, but even more so for just the chance to sit and learn and enjoy these remarkable presentations. I wish we could do this every week. And this has been indeed an important another example of a really unprecedented collaboration that has emerged as we were responding to this crisis, collaboration on the side of advocacy, technical challenges, and embracing technical opportunities, and then learning. So I've really enjoyed this. I'll be sharing today a perspective from the field, from an operational agency. We are operational. We're on the ground responding to COVID in communities in over 70 countries. So having talked to our staff in dozens of those countries, that's where I'll be sharing from just briefly this morning. This is the biggest initiative that World Vision has ever undertaken, like I think probably everyone has spoken today, impacting communities and families and children everywhere that we work. Thankfully, we've been able to build on pre-existing relationships and programs where we've been working for many years and pivot quickly to respond to COVID-19. You can see here that in our global response, we have 4 strategic objectives that are really linked, and this speaks to the multi-sectoral aspects that have been alluded to a number of times. The first 2 objectives are related to the health measures more. The first is to the prevention of the spread of COVID-19. The second, speaking to an earlier question, one of our top-level strategic objectives is to continue to strengthen the health systems and workers, not only to respond to COVID-19, but to the ongoing needs that children and families have. The third and fourth I'll be speaking to more today, of course, are looking at the secondary impacts. Particularly today, we're looking at child protection, but again, the interlinkage with education, food security, and livelihoods, and recognizing that these are not competing crises, but that the child protection issues are very much interwoven and interlinked with these other challenges that families and countries are facing. So, and then finally, of course, advocacy. We're really working a lot on advocacy with governments. So before I share specifically what we're doing to strengthen child protection as part of this broader global response, I want to share 5 quick observations which have shaped our efforts so far as we try to deliver on the commitments we made in the leader's statement and commit and encourage others to do so. And I will share just a few examples, mostly from Pathfinder countries with the Global Partnership, since that seemed particularly relevant. First of all, we can say from the community level where we are working and where we are connected is that indeed the signs, we're seeing a lot of signs that the suspected increases in abuse are actually happening. Whether that is increases in hotline and helpline calls or in arrests of domestic violence or child abuse crimes in Mongolia, Uganda, or South Africa, or informal reports as we are in touch with child protection committees in the Philippines or Peru. We're seeing increased signs of domestic violence, physical abuse, substance abuse, neglect, sexual abuse. In India, just recently, we've intervened in and stopped a number of child marriages, working with partners, of course. And then we just recently, in the recent days, stopped a number of online sexual exploitation of children situations in the Philippines. Second point that was mentioned earlier, the remote access is just so challenging. All of our typical modalities for engaging with families have been interrupted. So our staff talk about trying to identify what are the existing contact points with family and children right now. Is that using social media, text messaging, radio, TV, loudspeakers and bullhorns, food distributions and cash transfers, or the health services in order to engage children and families. Third is this the inconsistent acknowledgement of child protection and social services as an essential service, even in some Pathfinder countries. I think it's worth acknowledging here that we have seen some countries where the pathfinding commitments have made a tremendous difference in regards to the prioritization of child protection from an early part of the response. And then others have not done so nearly as much, and staff have expressed the need for continued international pressure in those cases. Fourth point here, we need to remember that the child protection systems were already stretched before COVID-19 hit us in many places where we work. Pile on top of that now the restrictions and challenges posed by COVID, and it's very, very challenging, as we've heard already in many of the presentations. But we've seen some positive efforts to address this. One example is the Philippines, where a number of government ministries have worked with civil society to revise and really strengthen the health and child protection referral pathways. Even there have been challenges as the social workers have been identified as an essential service. Many of them have been deployed into the COVID response. And so it's hard to find the time for child protection work. And then finally, COVID does not operate in a vacuum. So much poverty already where we are working. And then of course, terrifying projections of an increase in poverty, patterns of abuse and exploitation, which are already existed, which are likely to be aggravated, as we've seen with previous epidemics like the Ebola. And then emerging new disasters like the terrible floods in Uganda this last week, or locusts and conflict, ongoing conflict, making the response extremely complex. So I'll just give a quick high-level summary of our child protection work at the community level and in partnership with government and others. In light of these observations. For our particular child protection work under COVID, we are still taking a systems approach, trying to strengthen the protective environment around children. That is still our goal and our approach. We've been building on the work we've been doing to strengthen child protection systems, working with child protection committees, local volunteers and authorities, faith leaders, caregivers, and children themselves. And that trust and relationships and communication that we've already had with community members and partners, even out to the most remote villages and internal urban slums, has been critical. Our child protection work focuses on 4 major objectives. I'll just quickly tick through these, pointing to some examples in Pathfinder countries, mostly Pathfinder countries. First one around reporting and referral mechanisms. Many, as has been noted, many of the typical reporting mechanisms have been disrupted, and we've heard that from children as we've spoken to them. Hundreds of or thousands of children have been affirming that. And even though where incidents are reported, there are a lot of question marks over how and who to respond. So we've been working with local partners to adapt existing reporting and referral mechanisms and equip frontline workers to respond so that it goes beyond the policy into actual capabilities in communities. One example is Mongolia, where we've been partnering with local multidisciplinary committees to provide case management for particularly difficult cases, and where we've worked with the government to start a new chat box in the 108 helpline, 108 helpline, with psychologists available 24 hours. Really good partnership there with the government. Second, we're working to adapt and prepare the standard procedures on alternative care for children who have lost their caregivers due to COVID-19. They've died, or who are their caregivers are hospitalized, fallen ill, or quarantined. And so one example where we've seen some good work on that is in South Africa, where the government has been proactive in affirming and supporting kinship care with increased cash supports also to households that have taken in children through foster care. The third and fourth here are focused on psychosocial support to caregivers and to children and adolescents who tell us that their families are stressed, overwhelmed, anxious, bored, frustrated. So we've been disseminating positive parenting tips and self-care messages through radio, TV, social media, and even megaphone. In some cases, we've been distributing kits like the tenderness boxes in Brazil to try to promote tenderness in the home during this time. A board game in Mongolia out to families, and digitizing life skills work in the Philippines. We've been in touch with 80,000 churches and mosques, supporting them in the help and prevention of COVID, and also in bringing monitoring of child protection issues and supporting positive parenting and psychosocial support. I'm not going to go into the detail on this slide. I just want to emphasize the important opportunities we're seeing around multi-sectoral approaches, which has been mentioned. Other sectors can address some of the root causes of violence against children increases, and also provide unique and sometimes the only opportunities to engage with families. So we're seeing some real important opportunities around child protection messaging and monitoring with community health worker protocols and around food distributions. And finally, just quickly, some of the lessons and challenges you asked me to speak to, Howard. First, the staff and volunteers, as we speak to them, they are stressed. They're under extreme demand, facing new challenges with no known solutions. All of them are not only responders to COVID, they're also survivors, caring for their own families, facing the same anxieties. Second is around the lock and lift, where we know that governments are going to be locking down and then lifting restrictions and then locking down over time and across different areas. And the need then for us to really prioritize adaptive management and empowering localized decision-making and creativity, and for donors to take that into account. Third, we've mentioned it all throughout, this crisis is not hitting all children the same. There are extremely vulnerable children, I want to point out, especially refugees and internally displaced children, children with disabilities, and others that have been mentioned this morning already. Fourth, we need to recognize that no single type of actor can deliver on what's needed for children's protection right now. Various actors are needed, and they play different roles based on context, so that's critical. And then fifth, is the need for ongoing monitoring of child protection issues. And earlier was mentioned the challenge of data. We are seeing the same thing, but we are intentionally trying to monitor through a range of methods to potential increases in child labor, child marriage, sexual exploitation, and deaths of caregivers, and proactively now doing scenario planning should we see any spikes. So that's all I have. Actually, that's not all I have, but that's all the time that I have. So I'll pass back to you, Howard. Thank you very much.
Thank you, Bill. And we know that you and World Vision International have so much more. That's a fantastic presentation. And actually, you touched in your presentation on many of the issues which have been raised in the Q&A as we've gone along. And I wanted to reassure people, because we are somewhat overwhelmed. Not surprisingly, we had almost 1,000 people online at one point. We're somewhat overwhelmed with the questions coming in. And we will, as I said earlier, do a job afterwards to look at the questions, put out the key themes, the key requests, and share links to resources, etc., which are available among many of the organizations on this call and beyond. We have about 15 minutes left. I'm going to try and orchestrate a final round of conversation with the panelists and directing some of the questions and comments to them. So in a moment, I'm going to come back to you, Najat, with two particular questions. One is from Shiroi in Save the Children Sri Lanka is there a role, what's the role for mass media in getting the messages out and keeping children safe? And a second quite specific question about how are UN agencies working together during this crisis to really make sure that SDG 16.1 and 16.2 are not forgotten and progress continues to be made. There's a subsidiary question to that about how UNICEF and WHO are working together, which I'll come to Corn for later. But Najat, if you want to speak briefly to the role of mass media and how you see, from your vantage point, UN agencies working together. I'm then going to say something briefly in response to the earlier question about children online. And then I'm probably going to come to Anna and Maria in Sweden with some questions. Najat.
Okay. Regarding the role of mass media, and I think we have many examples in many countries when you have not only online, but you have TV or you have radio who are involved in really delivering also lessons to many, many children. And I think this is very important. They have a role to inform, to reach children and more widely the community, to provide information. And what we see also, we have to be very careful regarding information, but because when you have too much information that are not very clear, it makes not only the family, the community, but also children more anxious and to feel more insecure. And I think the role of mass media currently, including also ICTs for me, is how we can provide child-friendly information on COVID and its response. This is very important. And also on the existing mechanism regarding also child protection and also all this peer-to-peer initiative. I think this is one big point. Regarding UN agencies, and today you have an example of working together, just to let you know that in the global partnership, we are part of it as UN agencies, as UN mechanism. When I start speaking, I was speaking also about, the agenda for action. It was done built on the leaders, the call of leaders, leader statement, but also on the SG briefing. And all of us, we established this agenda of action, and we have a UN interagency working group on ending violence against children that really embrace OHCHR, UNICEF, WHO, UNODC, I am forgetting, ITU, UNHCR, IOM, and so on. And in the same time, what is important for us is really to share information and also to have a kind of targeted message. And regarding also the briefings that was done by the SG, many UN agencies were involved. And I think it's important for us that we have this message very strongly, to have this, as I was telling in the beginning, to have a common voice, a unique voice, and also to make sure that not only the advocacy agency mechanism are speaking, but also the implementing agencies at country level, at regional level, and at global level, and not only in New York, but in Geneva and in other region, really has to be part. If we are not really, and what I heard today, because I read all your question, and I think here I turn to Howard, and I think we need to share all what is going on, because it's amazing the number of guidance, of tools, of call for actions that were established. And I think here, for me, what is important, the lesson I learned, and since the beginning of the COVID and since the beginning of my mandate, we need really to make sure that all these tools, all this information are shared, and all the actors at grassroots level, at local level, and children themselves have access to that. And just it will be my recommendation after this meeting, because many questions are more practical or more dedicated to but showing that there is a need for all the UN system and the global partnerships, as we are part of it, to be this platform to share and to inform in a regular and updated way. Over.
Thanks so much, Najat. I'm going to come in a moment to Anna and Maria in Sweden with a couple of questions if you want to speak to them. One is around, are there any efforts you're seeing to disaggregate data, in particular by gender, of the experience that boys and girls are having, and as that obviously is a key need to inform the policy and the programmatic intervention and response. And secondly, a question around high-income countries. Obviously, this is a global issue. Violence against children, of course, is a global issue. And are you aware, I'm asking you because you are a high-income country in Sweden, is there anything that comes to mind for you in Sweden about high-income countries? Is there more that we collectively could and should be doing in high-income countries? Because we also shouldn't just assume because a country is high-income that is necessarily managing to do everything that's necessary. So any thoughts you have from a high-income country perspective on how we might better collaborate? Before I do, I just wanted to respond specifically to the earlier point raised about resources for online. There are a wealth of resources for protecting children online. The Global Partnership worked with UNICEF, the Broadband Commission, UNESCO, UNODC, the We Protect Global Alliance, and many others. And there's a series of technical notes, advice for parents and caregivers, advice for policymakers, and advice and calls for action for the technology and telecoms industries. So we will, as part of the follow-up to this, make sure that we share, as Najat has said, all the information, all the advice, all the resources that we know and are aware of that is evidence-based and as rigorous and packaged as best we collectively can in a compelling and accessible way. And a lot of that advice has now been translated into over 100 languages. So you will also be able to access some of this advice in your languages too. So Anna and Maria, if you want to address those questions about disaggregated data and about the high-income countries.
Yes, I think regarding disaggregated data, you have some answers for that, Maria or Laura, that you wanted to comment?
Yes, please. I'll leave the word to Laura.
Okay, and we'll get back to the other question.
Yeah.
Thank you.
Maybe I can just start by stating a little bit what kind of learnings we can get from the high-income countries. What we are discussing is really that the COVID-19 is a kind of X-ray that is going to unmask all the weaknesses and dysfunctionalities in the society. And I think that it will be a stress test for these INSPIRE strategies. What is functioning in our countries, and what are the things that we should fix? And that is one thing that we have been working very much in Barnafrid, really to take an analytic look at the COVID crisis based on the INSPIRE framework, based on our mission really to eliminate violence in the against the children by 2030. And I can maybe share my screen here to show you these things that we have been discussing. So what we should consider is try to keep our thinking and discourse nuanced, because it happens very quickly that we lose the perspective, the different kind of perspectives. We lose the short and long-term consequences. We start to look at the children as a very homogeneous group of people, but the needs in different age groups are very different. There are vulnerable groups, there are groups of kids that are just doing fine. That we can see also in the Swedish society, that some kids like that the parents are more at home, for instance. So very important thing is the fundamental decision that we try to keep the child perspective in all type of decision making, that we try to minimize the exposure, try to address the known risk factors that are related to individuals, children, boost the families, but also stick with the supportive societal functions. And one of the really main societal functions in our analysis is the daycare and schools, because they are not only providing education, they are providing free lunch, they provide activities, they provide social contacts for the kids, they provide health care. The younger kids can sleep there in peace. And we have stuff with the mandatory reporting obligation. So in that way, it's a surveillance system in a nice way too. I think that we should try to have micro units. Yeah, sorry, I will. Yes,
okay,
and
wrap in the next few seconds. Thank you.
Yeah, so lessons from the high-income countries, how is the system doing? And the other lesson is maybe how can we digitalize educational activities and have distance learning possibilities? Thanks
so much, Anna Maria and Laura. And sorry to cut you off. Just have a few minutes left. I want to make sure we do get the chance to come briefly back to the other panelists. I'm going to come in a moment to Cornelius to talk very briefly about how UNICEF and WHO are working. I've seen some great work, particularly around parenting, for example. And there's a lot of questions around internet access, both the expansion thereof, but also what about children who don't have access to the internet, which builds a little bit on what Laura just said around the digitization, particularly of education, but also the digitization of services. And how can we make sure that children with the best will in the world who won't have access to the internet, what that means for them, how we make sure they don't get left behind. I'll come to you in a minute, Corn, and then Joan, I'll come to you with a couple of questions, one around quite specific about the modalities of the cash-based support you mentioned, and a second around how can CSOs in Africa inform the policy and the planning and programmatic response by regional-based organizations, and examples such as SADC and ECOWAS were given. So Cornelius first, and then Joan, and if you can please be really brief so we get the chance to come back to Bill very briefly at the end. Thank you.
So quickly, actually, we are working with WHO. We worked with them on the recent guidance that was provided on protecting children from violence, abuse, and neglect in the home during this COVID-19 period. And it was a joint work with the Global Partnership as well to end violence. And this was followed by a joint webinar. It was based on evidence and the strategy from INSPIRE and the Child Protection Minimum Standard. In addition to that, we're working with WHO on the parenting. And you must have seen by some of the interventions I mentioned that these interventions come from the INSPIRE as well, on the parenting and on the support and response to children. So we're using the evidence and building on the evidence, and the work that our colleagues are doing in the field is building on that evidence. Over to you, Howard.
Great, thanks, Corn. So Joan, do you want to take those questions about cash-based, the modality of the cash-based support you mentioned, and how CSOs can inform the regional bodies in Africa?
Yes, Howard, thank you. On the cash-based support, we have already seen this established in different countries. We've seen it in South Africa, in Malawi, in Kenya. And how that is done is a coordinated system between civil NGOs on the ground, child protection officers within the government unit, and a system and structure is set up. First, within a framework, and second, very clear guidelines on how vulnerable children and households, for instance, orphaned children, vulnerable children, are identified, and then that is transferred to them. Of course, it does help that in a lot of these countries, there is mobile money transfer, but really it's a very structured system that grew from a collaboration between government and civil society. And that is really one of the things that can really be useful now in stepping up and reducing the vulnerability of children to violence. On the second question, in terms of working with the regional economic communities, we at African Child Forum are already doing that. And how we have started is first work coming through an entry point of understanding what are the frameworks for child protection at a very broad level, and how do we make sure that these frameworks are consistent with the African Charter and with the CRC, and then picking from that and developing very clear guidelines at two levels. One, how the member states themselves interact in developing and implementing these frameworks, and second, then how the unit itself as a regional economic community interacts with the African governance structures, the African Community on the Welfare of Children and the AU itself. And it's going fairly well. It's something that we are working on and have now rolled out from East Africa and also to SADC and soon to ECOWAS as well. So it is an opportunity. Thank you.
Great, thanks so much, Joan. We're just at time. I'm going to come to Bill. And Bill, there's an overwhelming demand for your presentation. I always love World Vision's documents, presentations, publications. They're also so it's co-compelling. So we will get that from you and share it with everybody. If you want Bill in 60 seconds or so just to respond or say any final words, there have been a few issues we haven't addressed specifically, which you did touch on. One was disability. Gender has come up a few times, and gender responsiveness, the voice of children, and a question about how we can get collective messaging together. I'm not expecting you to respond to all of those, but Bill, I'll give you the floor just to respond to any or other that you choose to in a 60 seconds or so, please. Thank you.
Great, I will keep it brief, but yes, I do think we are certainly hearing from the field concerns about children with disabilities and even where services are being extended to communities and to families, even through schools and others. Often children with disabilities are not being intentionally included in that. And I think that's what it comes down to, is intentional inclusion, working with local partners to ensure that the services are accessible and useful to families who are facing challenges that they've always had so much support with in terms of school and elsewhere. Gender issues are critical. We know that there are specific risks that girls and boys are facing that are different from each other that will change over time. And that comes down again to listening to children. That was one of the other questions, and I'll just hit that the last time. I think we can't do enough listening to children about their own lived experience right now. Let's not assume that we know. Let's look at the data and look at the media, but also let's make sure we are certainly in all of our countries carving out structured spaces to be able to hear from children what is their experiences, what are the risks that they're facing as girls, as boys, as children from different backgrounds, and specifically children with disabilities, in order to be able to better serve them. So we'll pause there. Thank you.
Thank you so much, Bill, for that very coherent response at no notice and no specific question. That's brilliant. Thank you. We're going to wrap up now. Let me just start by thanking our great panelists, Najat, Cornelius, Joan, Anna Maria, and Bill. Don't try and give a round of applause. We tried to sing happy birthday on Zoom recently, and we can tell you it doesn't work across time zones, not as applause, but we're incredibly grateful for your time, your expertise, and actually what you're all doing out there in the world to make children safe. And we look forward to continuing the conversation with you. Just a few points by way of summing up. I'm not going to try at all to summarize that incredibly rich 90 minutes. There are dozens and dozens of questions we haven't got to, and we will. A key follow-up, which as Najat said, is really getting the tools and the practical actions to the evidence-based tools and actions to people who need them. We'll be doing further work with all of our partners to make sure that we are learning from the country-specific context, listening to the voices of children themselves, making sure that we are putting together the responses, the advocacy, etc., that is needed, and making sure, as I say, that's informed by children and it's country-specific as well. And I think going back to something Najat said right at the start, which was something around the short-term response we've all had in this initial phase of COVID, which has unfolded at different timescales in different countries. It may not yet have peaked in some countries, but the fact we need to learn as we go and be proactive to prepare the longer-term strategies for the next waves and the various new realities that children will face over the coming months, maybe the coming years. And for that, we need the solidarity, we need collaboration, the unified voice, and unified action as best we can, all based on evidence and supporting one another across the world with the endeavor for this work. So thanks so much again to the panelists. Thank you to the nearly 1,000 people who were on the webinar at some point. And just two particular thanks to Andrew Hassett and Trang Ho Morton from the Violence Secretariat, who were the brains behind and the logistics of making this actually work with this many people. And finally, thanks to the participants. Thanks for the great questions, which we will be following up on the key themes. Not every question necessarily, but all of the key themes addressed, suggested and asked will be responded to over the coming days, etc. Thanks, everybody.